But what about the turbinates? If you peel back that septum that I had in the other diagram, you'd look at the side wall of the nose and you'd see turbinates. There are 3 pairs of turbinates in your nose: inferior, middle, and superior turbinates. And the inferior turbinate is the one that we're going to be talking about, and it's the one that can essentially block your nasal airway by being swollen. If you catch a cold, it almost completely obstructs your nasal airway just due to swelling. It's composed of a very vascular lining, so that changes with time, and a bone on the inside which doesn't change shape. In cases where with nasal steroids there's still so much tissue there that it's blocking, or the bone is enlarged, we can actually do a surgical procedure to reduce that septum, turbinate, such that you actually have a better nasal airway. Initial management, as I mentioned, is nasal steroid therapy or allergy management. But failing that, there are a number of different modalities that can be used to reduce turbinate size. One which you may have heard about is radiofrequency ablation of the turbinate. And with this, it's an office procedure where essentially a probe is placed into the turbinate with local anesthesia, and radiofrequency energy is applied to it, and scarring and shrinkage of that turbinate occurs. Usually 2 or 3 sessions are required. Failing that, more invasive surgical procedures can be performed where we actually go in and remove tissue. Microdebridement involves placing a device called a microdebrider that actually removes soft tissue from the area. We can actually just sort of break them, push them out a little bit, which is probably the least effective of these. It's often done in combination with other things. Or a mucosa-sparing resection where we actually make an incision with a knife, go underneath and remove some of that bone such that there's less projection of that turbinate into the nasal airway. Just a quick point about turbinate resection. In the past, complete removal of the turbinates was advocated. As I mentioned earlier, humidification of the air is one of the important functions of the nose, as well as filtration. And it's possible to over-resect the nose. So mucosal sparing turbinate surgery is really the way to go in modern nasal surgery. Look at the side.